How can PCOS or Polycystic Ovarian Syndrome be reversed through lifestyle and diet? I'm Dr. Rawat, a physician with over 25 years of experience who studied nutrition at Harvard, founded healthgroupcoaching.com, and is currently writing a book titled Slow Aging, Reverse Disease, and Optimized Weight. What exactly is PCOS anyways? It can be described as a spectrum. Not all women with PCOS will have similar symptoms. They could be somewhere on a range, and often it is described as a female version of metabolic syndrome or insulin resistance, which often also includes other symptoms and conditions including fatty liver, insulin resistance, type 2 diabetes, and overall an increased risk of cardiometabolic disease later in life. This is the American Association of Clinical Endocrinologists guidance for diagnosis of PCOS, and a woman needs to satisfy 2 of 3 criteria in order to be diagnosed with PCOS. You need to have a clinical or biochemical evidence of hyperandrogenism, and this would be an increase of serum free testosterone in the blood test, signs of hyperandrogenism, which would primarily include excessive hair in a male pattern, so facial hair, for example. The second feature would be ovulatory dysfunction, meaning having irregular menses, including frequent anovulatory menses. And the third criteria would be the visible signs of polycystic ovaries on an ultrasound or abnormal AMH levels in adults. Note that these 2 signs are less accurate in adolescents, and only 2 of these 3 criteria need to be fulfilled for diagnosis of polycystic ovarian syndrome. Remember, however, that like insulin resistance, prediabetes, or fatty liver, this is a condition which is on a spectrum, which means if you follow a good lifestyle and diet, you could have virtually no symptoms of this, while if your lifestyle and diet is not the best, then you could be quite symptomatic. You will often be on a spectrum on this condition. One may wonder why it is even worthwhile to make a diagnosis of PCOS, and the main reason for this is that if you know that you are on that spectrum, then there are lifestyle, dietary modifications that you can make to become less symptomatic, to have less difficulty with fertility and the other symptoms that you may have. And particularly for women who wish to conceive, it is useful information to know that although they will be able to conceive eventually, they do not become infertile because of PCOS. It is a condition which can lead to subfertility because you can have anovulatory cycles, meaning cycles which are not associated with production of an egg, and as a result it may take longer to conceive, and having that awareness can be useful. This is an article which talks about the optimal management of PCOS in adolescents, and they do make a note here that raised sugar, raised cholesterol, fatty liver disease, sleep apnea, and heart disease can be more common in those women who have PCOS, and treatments can include lifestyle modifications, hormonal contraceptives simply to regulate periods. Bear in mind though, this can have an effect on fertility, so important to stop the OCP in time if you do wish to conceive, because it can take time for the ovulation to recommence. And also insulin sensitizers can have a role, particularly if ladies have particular symptoms. As an example, if you have particular hirsutism, which means facial hair growth, and medication which also has anti-androgen effects like spironolactone can be effective. If you're struggling with weight, then metformin can also help somewhat with weight loss as well. Women often worry about the lack of ovulation and delay in fertility with PCOS, and what kind of factors may help with that. This is a review article which discusses that and recommends that weight loss, exercise, and lifestyle modifications are the first step when trying to improve ovulation in women with PCOS. It is important to highlight that morbidly obese and obese women with PCOS will often be metabolically unhealthy. They may be pre-diabetic, for example, and even if they're not, they may be at risk and would very likely develop gestational diabetes in pregnancy. And for having optimal outcomes during pregnancy, it's really quite important that these women not only start taking prenatal vitamins and following a healthy lifestyle and diet prior to conceiving, they also try to lose weight, even if they have to delay onset of trying to become pregnant by a few months, but try to get into a state of better health before becoming pregnant, because all of this becomes quite difficult once you do become pregnant. What are the lifestyle and dietary strategies which could help a woman with PCOS? Next, I'll be sharing a study which discusses just that. In this study, it is noted that in the American population, up to 10% of women could have PCOS, and this can be associated with heart disease, diabetes, and metabolic syndrome. Half of them are overweight or obese, and the kind of dietary recommendations they make are similar to the kind of recommendations you would make to a type 2 diabetic. And this includes increasing fiber, reducing refined carbohydrates, reducing trans and saturated fats, increasing omega-3 and omega-9 fatty acids, increasing food which contain anti-inflammatory compounds like fiber, omega-3, vitamin E, and red wine. So what are the kind of practical things that you could do? In order to increase fiber, you would want to eat more whole intact grains. So these are grains which have not been milled, which have not been turned into a powder. These would be grains like brown rice, millets, steel-cut oats, quinoa, and even if you go for a bread, then try to go for a good quality sourdough with flax seeds, for example. Reducing refined carbohydrates means reducing those kinds of foods which are often coming out of a bakery. So reducing any foods in which the fiber or the outer bran has been stripped out. So decreasing your white rice, white bread, croissants, cookies, muffins, cakes, fruit juices, sodas which contain calories. Reducing saturated fats, and that would be reducing red meats, fried foods, palm oil, coconut oil, butter, ghee. Increasing omega-3 fatty acids, that's primarily by increasing your fish intake, avocados, olives, nuts and seeds. Increasing anti-inflammatory compounds with fiber. Fiber, apart from whole intact grains, is also included within whole intact vegetables, particularly green leafy vegetables, also within fruits, seeds, and nuts. Increasing vitamin E, which is found the most within seeds and nuts, and that could be seeds such as flax seeds, pumpkin seeds, hemp seeds, chia seeds, nuts such as walnuts, almonds, pistachios, and also increasing beneficial anti-inflammatory compounds, which can include some pleasurable foods such as red wine, dark 90% cocoa chocolate, black coffee, and green tea. Similar to as in fatty liver and pre-diabetes insulin resistance, the seed of the problem is within the liver because of excessive fat deposition within the liver and visceral or truncal fat around the belly. That is what leads to the overall presentation of insulin resistance and PCOS. Are there any specific dietary modifications and or supplementations which could help in this regard? In this study, women with PCOS were given an omega-3 supplement and followed up using a proton magnetic resonance spectrometry to measure the amount of fat in the liver. And it did show that giving omega-3 supplementation had a beneficial effect on liver fat content by reducing it, as well as reducing other cardiovascular risk factors. So as you can see in this study, not only was liver fat reduced compared to the placebo group, they also saw a reduction in triglycerides, reduction in systolic blood pressure, reduction in diastolic blood pressure compared to placebo. We have already discussed the role of lifestyle, diet, exercise, vitamin E, and omega-3. Are there any other dietary lifestyle changes or supplements which could help in this regard? This is a study which investigated the effects of soya isoflavonoids on metabolic status of polycystic ovarian syndrome, and they found that within just 12 weeks, there was a significant reduction in insulin resistance, hormonal status, triglycerides, and biomarkers of oxidative stress. Interestingly, soya isoflavonoids are much more commonly used for alleviation of symptoms of menopause because these are phytoestrogens, but they also appear to help with PCOS. In my previous video on reversal of prediabetes, I had also mentioned soya isoflavonoids because they have been shown to improve or rather reduce insulin resistance, and that is primarily how they're having an action here. An easy dietary way of introducing more soya isoflavonoids into your diet would be to replace cow's milk wherever possible with soya milk. Cow's milk is beneficial in growing people, so because it contains growth factors, it does increase height. So as long as you're growing, I think it's completely reasonable to continue having cow's milk in order to maximize your growth. But once you have hit your peak growth and you're not getting any taller, it's definitely reasonable to change to soya milk. Soya milk containing isoflavonoids has also been shown to reduce risk of breast cancer, while cow's milk, because of the effect it has on growth, has been associated with positive associations with cancer. And so once you hit your peak growth, it's definitely worthwhile to change over to soya milk. It also, in addition to containing isoflavonoids, contains fiber, which will reduce sugar and reduce saturated fat and will be better for your gut microbiome and metabolism in general. Of course, making dietary substitutions is not easy for everyone. And on my website, healthgroupcoaching.com, I also have our product recommendation and a blog, which I'll be linking below on this video, which will discuss particular supplements which you could consider to help you along that journey. This was a 12-week intervention, and just within 12 weeks, the isoflavonoid group saw a significantly decreased level of insulin. They also saw improvement in HOMA-IR, which is a measurement of insulin resistance, as well as a reduction in free androgen index, so the amount of testosterone also reduced, as well as reduction in triglycerides compared to the placebo group. They also saw an increase in glutathione levels, and glutathione is an antioxidant. There is one more nutritional association which I would like to mention here. PCOS has been associated with significant levels of low vitamin D. To what extent that could be contributing is difficult to measure, as the condition itself is quite common. 90% of vitamin D is absorbed through sunshine. It is an hormone, as we know. It also modulates your immune system, your bone strength, and your muscle strength. We know that we need strong bones and less fat in the liver in order to counter insulin resistance. So it is definitely worthwhile to get your vitamin D levels checked and get the levels corrected if you are found to have low vitamin D levels. I would like to point out here that using super physiological or very high levels of vitamin D once or twice a month or so has been found in clinical studies to be not as effective as a more regular intake of vitamin D. So I don't recommend a frequency of anything less than once a week of vitamin D3. If you have been advised to take a super physiological dose of vitamin D once or twice a month, then I would suggest you come down to a lower dose to be taken at least once a week to get the vitamin D in a more physiological way. I will be linking some supplements that you could consider within the blog, within the description of this video. So in summary, PCOS can be reversed, but bear in mind that most women who have this condition, because there is a genetic basis to this as well, will lie on a spectrum. They may have minimal symptoms because they are of a low body weight, they have good muscle mass, they have a healthy lifestyle and diet. However, as they get older and perhaps accumulate more fat around the belly, lose muscle, become less active, they could start developing PCOS, in which case they would have to make steps to reverse that. However, you will always be on that spectrum. This is similar to what we see in insulin resistance, fatty liver, prediabetes, etc. What would be the healthiest way of losing weight? Well, I coach on this on my coaching program at healthgroupcoaching.com. I would recommend a whole food diet cutting out ultra-processed foods, some degree of mild intermittent fasting, which I recommend in a circadian fashion, also called ETRF or early time restricted feeding, essentially eating early in the day, not eating late in the day, pairing your eating with the time of day when you are most insulin sensitive, when you are doing the most activity and exercise and are most likely to utilize that energy and not store that energy, avoiding eating late in the day when you have higher levels of melatonin, you're more insulin resistant, you are less active and hence more likely to store that energy as visceral or truncal fat rather than utilizing that energy. Ultimately, our body will listen to the signals that we give our body through our hormones, but we do have to give our body the right signals through our hormones and through our activity. In addition to a healthy diet, what kind of supplements could be considered to help with PCOS? These would include omega-3, vitamin E, soy isoflavonoids, as well as certain types of anti-inflammatory polyphenols. I'll be putting details of these supplements within the blog in the description of this video. I hope you found this video useful. Do share it with any friends or family who may benefit from this information. If you're interested in coaching with me on a Zoom platform, then consider subscribing on healthgroupcoaching.com. Even if you do not wish to pay for a one-to-one coaching and just wish to receive recordings of sessions, there is a free option on the website as well, where you can just subscribe and get the recordings of sessions for free. Over 8 Zoom classes in a span of 4 weeks, 8:30 p.m. Eastern Time, Tuesdays and Thursdays. I coach on the causes of metabolic disease, intermittent fasting, a whole food, hyper-nutritious diet, and anti-inflammatory diet to slow down the aging process, gut microbiome optimization, sleep, stress, exercise, and resistance training, supplements to reverse metabolic disease. And we also have a session discussing how to slow skin aging as well as menopausal symptoms. If you would like to learn more about the program and how to slow down aging, then click on the video appearing on the top. If you would like to know how to reverse fatty liver, then click on that video. Take care everyone, and I'll see you at the next video.